Hi, this is Jennifer with Custom Chiro Solutions. This is a demonstration of the Future Health or eConnect system. In this demonstration, I'm going to walk through how to do an exacerbation move in Future Health. To begin with, I went ahead and selected our patient, and then I selected Start New Note under the documentation. Once we're here, we're going to go directly to our problems list. If you have any active problems that are previously listed in here, you can simply right-click on them and then select Deactivate. So depending if that is a problem that is still active on this patient, you can go ahead and deactivate it and go ahead and move it down here to the very bottom. To add a new problem, we're going to come up to Add Problem. You can type in the individual problem diagnosis code. And then once we've selected our diagnosis code, we can also select our onset date and our onset type. So if it's a result of an accident or injury, and any additional comments. So we went ahead and added our problem. And then we can go ahead and it is currently added to our current note, so we're all set. So we're going to move right down to our free-form SOAP note section to begin entering in our SOAP note. Once we've selected our subjective free-form macro picker, we're going to scroll down here to the bottom where it says Exacerbation, and then our choices are either adult or children. So I'm going to select adult, insert, and then we're going to come down to objective free-form macro picker and come down to exacerbation. And once again, either choose children or adult. There we go. For exacerbation or for any kind of exam, we want to make sure that we select our segments where part was demonstrated. This can be found underneath the global macros. So I'm going to go ahead and select C1. Just a few of these segments. And then insert. Goes ahead and updates our objective note. In assessment, it's the same. We're going to select OATS. OATS is done anytime that there is a exam on a patient, so re-exam, re-x-ray, or a new patient, or in this case, exacerbation. And then we're going to select our assessment. Double-clicking to input in our OATS score and goal today. And then under plan, we're going to go ahead and set up our patient's treatment plan and our recommendations for them for this new condition. And if the patient was adjusted today, we also want to come down to daily note and select our daily note option. So it just completely depends on what was performed during today's visit. In this case, I'm going to go ahead and select daily note as well. And then I'm going to come under Enter Codes and enter in our diagnosis codes. Diagnosis codes are listed under the plus sign. This is our favorites group. So if this wasn't a result of an auto accident, I would come down here to our PI case and select neck pain. And then for any of the services that were performed today, for instance, if it was an exam done, then I can go ahead and select exam. I can select our ultrasound and stem possibly, and then the segments that might have been adjusted. There we are. So this completes our exacerbation note. We can come under complete note and take a look at exactly how this lays out and how it reads.